On my presentation, we have benchmarked the contributions. We are comparing KIPP's current contributions to local nonprofits around Jacksonville and the average employer contribution percentage for employee-only coverage. KIPP pays an average of 112%, while other employers pay 83%. The average employee contribution for employee-only coverage for KIPP is negative 26.04 and $87.48 for other local nonprofits. So KIPP far exceeds some competition that's out there as far as what they contribute for employee-only coverage. KIPP also contributes to dependent tiers. So for family coverage, an average percentage that KIPP contributes is 61% for family coverage, while other local nonprofits contribute about 58%. The average employee contribution for family coverage for KIPP is $311.14, and compared to other local nonprofits, that's about $529.01. So family coverage in this slide, it includes employee, spouse, employee, children, and family tiers. So this is just a benchmark that we've created just to compare where KIPP sits as compared to other local nonprofits. So we wanted you guys to have this information just so you are aware of KIPP's contributions towards your plans. So now I'm going to start reviewing the benefit booklet, which contains all of your new plan information for this coming plan year, which begins August 1st, 2017. I'll get out of this and then go straight into the presentation. So welcome to your 2017 benefits year at KIPP Jacksonville. If you are a full-time eligible employee, you're eligible to receive the benefits that this webinar is going to review. Today we will review an introduction to your benefit options, healthcare reform updates, and a summary of the plans offered. Additionally, we will walk through Employee Navigator, your new benefits administration system, and see how you can elect and make changes to your benefits. KIPP Jacksonville's benefit year begins on August 1st of each year. The open enrollment period occurs in June. So right now, this is the period where you can make changes to your benefit elections for the upcoming. Also add or drop dependents and add or drop your coverages. All benefit elections made during open enrollment or your new hire period remain in effect for the rest of the plan year. During the plan year, making a change to your elections requires a qualifying life event, such as marriage, legal separation, birth, death of a spouse or a child, loss of coverage, or change in eligibility status for benefits. If you do have a qualifying event occur mid-year, you are required to upload documentation to substantiate that qualifying event. In that, you can do that through Navigator, and I'll briefly do a demo of Navigator, which is how you make your benefit elections for open enrollment and during the year. I will show you guys how to upload documentation for a qualifying event. You'll notice in red the open enrollment period is June 12th through June 19th. So it is important for everybody to make sure their elections are in the system by 5 o'clock on June 19th. Okay. Benefits termination in COBRA. If your employment with KIPP Jacksonville is terminated or you cease eligible employee, you may continue your medical, dental, and vision benefits by electing COBRA coverage. If you do not opt to continue coverage, your benefits will terminate at the end of the month. If you do elect COBRA, you must pay the full cost of coverage plus a 2% administration fee to keep your benefits for up to 18 months or longer in certain circumstances. Your qualified dependents. Certain benefits allow you to cover dependents. For the benefits offered by KIPP Jacksonville, eligible dependents are defined as your legal spouse and your child or children. Your medical plans will cover a child up to age 30, and your dental and vision plans will cover a child up to age 26. For any children who are incapable of self-support due to mental or physical disability, coverage may be extended. Next, we will review a few key healthcare reform rules. First is the individual mandate, which requires individuals to have health insurance or pay a penalty on your tax return. That penalty is $695 per person. The fine for children not having coverage is $347.50 per child. The household maximum penalty is $2,085. To comply with the individual mandate, the government has created health insurance marketplaces, which is where you can shop for individual health insurance and compare your options side by side. It's important to note that the coverage offered through KIPP Jacksonville is considered affordable and provides the required minimum value standard as defined by the ACA. For this reason, if you choose to obtain coverage through an exchange, you will not qualify for subsidy assistance. If you choose to elect coverage through the exchange while employed by KIPP and you receive a subsidy, you may be responsible for paying that subsidy back. No pre-existing condition limitations. That just means due to healthcare reform, you will not be denied coverage due to any pre-existing conditions. Summary of benefits and coverage. These are easy to understand documents that go over your plan, and they are available on Employee Navigator, and they are directly from the carrier. Okay, now we will be reviewing your benefits through Aetna, which are your medical, dental, and vision. The first plan that we're going to be reviewing is your Medical Gold Plan. This is the highest plan offered. This plan utilizes the Managed Choice Open Access Network. So if you are searching for a provider, you want to make sure to use that network. More information on how to find a doctor is also listed in your employee benefit booklet, which is posted on Employee Navigator. For the purposes of this presentation, we will only be reviewing your in-network benefits, but just note that some of these plans do also have out-of-network benefits, which I will mention. For this plan in particular, this is a PPO plan, so it does have in and out-of-network benefits. You will receive the most benefit, though, by staying in the network. Mayo Clinic is included in the network with this plan. You do have a calendar year deductible of $2,000 for an individual, a $4,000 family calendar year deductible. You have an out-of-pocket max of $5,000 for an individual and $10,000 for a family. Your out-of-pocket maximum is the most that you'll pay for covered health expenses in the calendar year. So once you've met as an individual that $5,000, your health insurance picks up 100% of the costs after that. So that really helps to protect against catastrophic events. You have a flat copay for your primary care visits, which is a flat $30. Your specialist visits are a flat copay of $60. Your inpatient hospital is CYD plus 300 PAD. Now what that means is CYD is calendar year deductible. So you would be responsible to meet that deductible. After you've met that deductible, you would pay a $300 per admission deductible. So if you are on an individual plan, your individual deductible is $2,000. After you've met that, you would just pay the $300 per admission deductible. So every time you've been admitted into the hospital, you would pay the $300. For your outpatient hospital, your therapy is a flat $60 copay. For outpatient surgeries, you would meet your deductible first and then pay a $200 copay. For emergency room visits, it's a flat $400 copay. Your urgent care is a flat $75 copay. For your prescriptions, you have your low-cost generics, at $3, your generic at $15, your brand prescriptions at $60, and your non-preferred brands at $85. Mail order is available with this plan. Mail order is a 90-day supply, so this is really great for any maintenance medications that you have. You can end up saving one copay if you do opt to get a mail order supply if you're on any maintenance medications. Your preventive health is covered at 100%, and this is for all plans. You do not have to meet your deductible first for preventive care. It's all covered at 100%. So this includes your annual mammograms, colonoscopies, your well women exams, well child, and your physical exams. Outpatient diagnostic services, which include your x-rays. So your x-rays, it's a flat $125 copay. MRIs or CAT scans, it's a flat $300 copay on this plan. And blood work is a flat $30 copay. You do have some out-of-network benefits, but they are listed in the benefit booklet if you do want more information on what those out-of-network benefits are. Moving on to the next plan is your silver option. This plan is the exact same as far as benefits as the gold plan that we just reviewed. So the benefits are exactly the same. The main difference is really the network. So this silver plan utilizes the Aetna Health Network option, which is listed right here at the top. So if you are searching for a provider, make sure you put that network into the system to find out which doctors are considered a network for this plan. One other major difference is Mayo Clinic is not included in this plan. So if Mayo is important to you, that gold plan is the only plan that currently offers Mayo. Like I said, these benefits are exactly the same as the gold plan, so I'm not going to go over them individually. Just know that the networks are a little bit different. So if I would recommend searching to see if your doctor is in network. The next plan we're going to be reviewing is your Bronze Medical Plan. This plan is an HMO plan, so it is an in-network only plan. There are no out-of-network benefits with this plan. The network this plan utilizes is the Health Network Only plan, listed right up here. So if you do need to search for a provider, make sure you use this network. For this plan, you have an individual deductible of $3,000. For a family, it's $6,000. You have a co-insurance split of 80%, 20%. So what that means is anywhere you see CYD on the slide, that means you must meet your deductible first, and then insurance picks up 80% while you pick up the remaining 20%. Your out-of-pocket max is capped at an individual at $6,500. For a family, it's $13,000. Again, that's the most that you're going to pay for covered insurance costs in a plan in a calendar year. Your office services, which include your primary care visits, it's a flat $30 copay. For a specialist, it's a flat $60 copay. You have an inpatient service fee of a calendar year deductible plus 20%. So you must meet that deductible first, and then insurance picks up 80, and you would pick up the remaining 20% balance. Your outpatient therapy is deductible plus 20%. For surgery, it's deductible plus $500. So for surgery, you would meet your deductible. After you've met your deductible, you would pay the flat $500 copay. For emergency rooms, you would have to meet your deductible also, and then pay the flat $500. For urgent care, it's a flat $75 copay. The prescription is the same as the other plans that we've mentioned. So $3 low-cost generic, $15 generic, $60 brand, and $85 non-preferred brand. Your preventive health is covered at 100% on this plan. Your x-rays, it's a flat $50. Your MRIs would be a flat $300 copay. And your blood work is a flat $25 copay. And the last plan that we're going to talk about for medical is the HSA medical plan. This plan is also an HMO plan, so it only offers in-network benefits only. There are no out-of-network benefits with this plan. Mayo Clinic is not in network with this plan. To find a provider, you would need to utilize the Aetna Health Network only open access network. With this plan, this runs in conjunction with an HSA health savings account, and I'll talk more about that in a few minutes. But that's basically a health savings account where you put tax-free money to help pay for some of the deductibles that are listed on this plan. So for your deductible, you have an individual calendar year deductible of $3,000. For a family, you have a family deductible of $6,000. So if you are on the family plan, collectively, you will all have to meet the $6,000, and then insurance picks up the remaining percent. Your co-insurance is 100%. Your out-of-pocket max, which is the most that you'll pay out-of-pocket for an individual, is $6,550. It's the same out-of-pocket max for a family. Your primary care, for this plan, you would need to meet your deductible first and then pay the flat $30. For the specialist visits, you would need to meet your deductible first and then pay $60. Most of the charges you'll notice on this plan, you will need to meet your deductible first. That's why it is called a high deductible plan, and it's paired with an HSA. Again, for your prescriptions, you would need to meet your deductible first. And then the prescriptions are $3 for generics, $3 for low-cost generics, $10 for generics, $50 for brand, and $75 for non-preferred brand. Preventive health, you do not have to meet your deductible first if you are enrolled in the HSA plan. Preventive health is covered at 100% without having to meet your deductible even on this plan. Your outpatient diagnostics for your x-rays would be deductible plus $125 copay. Your MRIs or CAT scans would be your deductible plus a $300 copay. And your blood work would be your deductible plus a $30 copay. Moving on to the next slide is your HSA, so health savings account. The health savings account helps you pay for qualified medical expenses that are not covered by your insurance plan. So this includes your deductible and co-insurance. So you can see that how this could really help being paired with that HSA medical plan. With most of the charges having to meet your deductible first, having money put away in a tax-free account really could help towards that. There are a few stipulations. You have to meet eligibility, you have to be covered under the HSA qualified high deductible health plan. You cannot be enrolled in Medicare. You cannot be covered under another health plan, and you can't be claimed as a dependent on somebody else's tax returns. There are maximum contribution amounts where you can contribute on a calendar year. So if you are taking single coverage under that HSA medical plan, you can contribute $3,400 in a calendar year. For a family, it's $6,750. If you are 55 years or older, you can contribute an extra $1,000, and that's considered a catch-up contribution. For 2018, if you are on the individual employee-only high deductible plan, you can contribute $3,450 to your HSA. And if you're on the family plan, which is employee spouse, employee child, or family tiers, you can contribute $6,900. The next plan that KIPP offers is a dental PPO plan. This plan was previously with Mutual of Omaha, and we are moving it to Aetna. With Aetna, you will see some benefit enhancements for this plan year. Your new Aetna plan will cover orthodontics for children, so that's children up to age 19. There are no waiting periods for services. Previously, there was a 6-month waiting period for major services. Now there is no waiting period. Endodontics and periodontics are now covered as basic, and they were previously covered as major. So endodontics, for an example of that would be root canals. Your periodontics, that would be your deep cleanings. If you are trying to search for a provider, you would just go to Aetna.com and utilize the network that's listed in the employee benefit booklet, which is available in Navigator. For your dental plan, your preventive and orthodontic deductible is waived. Your basic and major deductible, it's $50 for an individual, capped at $150 for a family. After you've met your deductible, insurance pays for 80% for basic coverage. For major coverage, they pay 50%, and for orthodontic coverage, they pay 50%. Your preventive care, you get your 2 cleanings a year, and like I said, your deductible is waived for preventive care. You have a benefit maximum of $1,000 per calendar year, and your orthodontic lifetime max is $1,000 as well. And this is the maximum amount insurance will pay over a lifetime for orthodontic services. Some examples of covered services under preventive care would be your oral examinations, cleanings, and full mouth x-rays. For your Class 2 basic services, that would include your root canal therapy, composite fillings, and your deep cleanings. And for Class 3 major services would include inlays and onlays and crowns. Like I said, again, just make sure you do verify that your doctor is in network. We did a comparison of the providers utilized through Mutual of Omaha, and we compared them to Aetna's network, and many of the doctors did not fall out of network. So most of you will see that the doctors or dentists that you've been utilizing are considered in network with Aetna. I would just advise you to make sure and check on that. The next plan we're going to discuss is the vision plan, which is through Aetna. It's the same vision plan as last year. This plan has in and out of network benefits, but I always try to encourage people to utilize an in-network provider, especially if it is a vision plan. Your out-of-network benefits on a vision plan really don't match up to your in-network benefits, so you will get a better benefit if you're going to an in-network provider. We've included on the bottom here some examples of your in-network providers, so that includes Sears, your Targets, Lens Crafters, Pearl Vision, JCPenney Optical. With this plan, your in-network benefits, your exams, you would have a flat $10 copay, and for a material copay, it's $25. Your material copays includes your single vision lenses, your bifocal lenses, and your trifocal lenses. You have a frame allowance of $130. After you've met that allowance, you're given an additional 20% off the balance. For contact lenses, you have a $130 allowance. After you've used that, you have an additional 15% off your balance. And discounts are also available for laser correction under this plan. This page lists the summary of contributions. KIPP will continue to contribute towards the cost of healthcare coverage with the Silver Medical Plan remaining at a zero cost for employee-only coverage. KIPP will also continue to subsidize additional premiums for your dependent tiers to help with the rising healthcare costs. So those additional subsidies for your medical plans are employee, spouse, and employee child coverage is $1,000 annually. For family coverage, it's $2,000 annually. The costs illustrated on this table are the employee per pay period costs after KIPP contributes towards the premiums. Taking all medical plans and all tiers into consideration, KIPP pays an average of 86% of your medical premiums, which is amazing. Your dental and vision plans, the employee-only tier, is also zero cost to you. There is a buy down and declination of benefits acknowledgement on Employee Navigator that you will see. This just reviews that policy, which I'll explain. So all full-time benefit eligible employees are offered a silver benefits package at no cost. This includes the following employee-only benefits: your silver medical, dental, and vision. If you choose to buy down or decline coverages, you will receive a stipend at the end of the fiscal year and subject to applicable terms and conditions. If you choose the Bronze Medical Plan employee tier, you will get a $550 stipend at the end of the fiscal year. If you choose the HSA Medical Plan employee only tier, you will get a $1,000 stipend at the end of the fiscal year. If you decline health insurance altogether, that's $2,000 stipend. If you decline dental, it's a $300 stipend, and then if you decline vision, it's a $50 stipend. So all of the dollar amounts that I just talked about are subject to the terms and conditions, subject to change if any employee isn't starting employment during open enrollment or doesn't complete a school year in good standing. I would advise, if you have any questions about the contributions, to see Allison in HR. This next page just reviews the Aetna membership resources that are available to you. If you go to Aetna.com, you should all have a member login where you can log in and pull up your claims, review your EOBs. You can pull a temporary ID card. There's also a really great mobile app that you can pull up on your phone in case you forget your ID card at home and you're at the doctor. You can pull it up on your mobile phone and have it right there. There's also a really great discount program that's available as an Aetna member. You can get discounts on things like your gym memberships, books, things like that. The site's constantly changing, so I would really recommend going onto the site and checking out what is available to you for free. Next, we're going to talk about your life and disability plans that are offered through Mutual of Omaha. The first plan is your basic life and accidental death and dismemberment plan. With this plan, KIPP pays for it 100%. It provides your named beneficiary a benefit of $25,000 in the event of your death while employed by KIPP. If your death is the result of an accident, your AD&D, which is your accidental death and dismemberment benefit, pays an additional $25,000. We would recommend that you go in and update your beneficiaries in Navigator. You can update them at any time, not just during open enrollment, so we want to make sure all of that information is accurate. The next plan is your short-term disability plan, which KIPP also pays at 100%, so it's no cost to you. It provides partial income protection during a period of disability, and it includes pregnancy. When you must be absent from work as a result of your own injury or illness or disability beyond the allotted number of accrued unused paid time off days, you may be granted a period of paid disability leave. The elimination period for an accident, your benefits would begin 1 day after an accident and 8 days after sickness. Your annual salary, your weekly benefit that is covered is 60% up to $1,500 per week. And the benefit is payable for up to 26 weeks as decided by your doctor. The next benefit that we're going to talk about is your long-term disability plan. So this benefit provides 60% of your basic monthly earnings up to a maximum of $6,000 per month. This benefit will begin after you've been disabled for 180 days, so this picks up right after your short-term disability ends, and it's payable until age 65 or until you are no longer disabled. This benefit is paid for 100% by KIPP as well. The EAP program, which is the Employee Assistance Program, is a free program that is available to you through Mutual of Omaha. It provides free resources such as counselors, financial planning, and legal assistance. There is a phone number right at the bottom here that we've included. If you need access to any of these resources, you have that right here. There's also a flyer in your benefit booklet that talks about everything that is offered through the EAP program. So definitely check out the benefit booklet if you need more information on this. Next steps is our enrollment. Employee Navigator is the benefit administration system that we are using to make your open enrollment elections this year. To make your elections, you would visit employeenavigator.com to set up your account. You can access this 24/7. You would log in to elect your benefits, change your plans, review plan documents, and there is a detailed benefit guide in your employee benefit booklet that reviews this process. The first step is to register your account. So you would go to employeenavigator.com, click on register as a new user, and then it will pull up this page here. Your company identifier is KIPP Jax, and KIPP is capitalized, and then the AX are lowercase. So it has to be entered exactly like this for it to work. Once you've registered as a user, you would come up to the landing page. This page you can see your profile, benefits, required task, resources. For this open enrollment, you don't want to click on any of those buttons. You want to click right up here where it says Start Benefits.
I'm already lost.
Then it's going to take you to this section where you have your profile, benefits, forms, and summary. The first thing you want to do is make sure all of your personal information is entered into Navigator correctly. You also want to make sure to enter in your email address right here at the very bottom. Then you want to click on Save and Continue to move towards the next module. And Brittany, I just looked at your question, and the company identifier is KIPP Jax, capital KIPP, lowercase AX. And the address to start the setup is employeenavigator.com. Next step would be to verify your dependent information. Here you want to add any dependents that you're going to be adding to your medical, dental, or vision plan. So this is the time to add that information. You want to enter in things like their first name, last name, relationship, either a spouse or a child, their gender. Make sure you have their social on hand, and then click Save. Once you've entered that, you would click Save and Continue. And now it brings you where you actually elect your benefits. If you have any dependents, your dependents will be listed right under where it says Myself. And if you're selecting benefits, so say for example you want to select dental, you would click right here on the actual benefit and it would highlight. And then click Save and Continue. Once you go through the benefits module, you will go through the forms, and this is where you update your life beneficiary. You would just click on Add a Beneficiary. You can add as many as you want. It just has to all allocate to be 100%. Then you would click Continue. And this is where you can see a summary of your election. So all of the plans you've selected to enroll in, your cost per pay period, and then you would just hit Agree to send it to HR. And this is the final step to submitting your open enrollment election. So this has to be done before the 19th at 5 o'clock. And this is the end of the presentation, so if anybody has any questions, please let me know. I will stay on the line to answer any of those questions for you.